calling this meeting of the Adams Board of Health order, 4 o'clock today, December 15th, 2021. Read our waiver. In-person virtual participation in this meeting is allowed by Chapter 20 of the Acts of 2021, suspending certain provisions of the open meeting law. Mass General Law, Chapter 30, Section 20. The Zoom information is given below. The meeting will be recorded via Zoom. A copy can be provided on request. It is being recorded. And I have given my cell phone number on the agenda in case someone is having trouble logging in from remotely. So your first item on the agenda is Mount Royal Inn, waiting for the owner here, Kathy Keezer, has entered the waiting room and is opposite Blaisdell available.
He signed in, but I don't see him.
Hey, it looks like the flood house. Oh, okay, excellent. You got it.
Just trying.
He's informed that the passcode was not valid. I had tried that. Me.
I tried it twice.
Really? Yeah. Seems to be getting in.
Yeah, okay. And muted, all right. Okay. We will proceed here, so when Roger Blaisdell to give us a background on the Mount Royal Inn lodging permit. He has informed me that Chief Cessation has signed a bar plan. He also said that building commissioner Warner has signed. We both North Building, South Building have passed building commissioner inspection. The remaining item is the Board of Health permit, which is pending and actually only at this point requires a sign off of the building commissioner on the Board of Health permit. So that's a good box on our online permitting system. And finally, all of the paperwork is done for the license from the Board of Selectmen, who will meet later on tonight. And we presume that will go forth as all the paperwork is in order. So I would like a motion to the Mount Royal Inn. Pending the final sign off of building commissioner and the select board approved it. Is there any further discussion?
So I guess I'm wondering, why are we just voting on to approve this one and not any of the other ones? And why is this one coming before us and other ones aren't?
That's not good enough. Now I got to unmute it. That's actually a good question, but I think part of the issue is because of the delay and the fact that we had there was some confusion about what Mr. Buscari had to submit. And so there have been a lot of backs and forths with the fire department, the board of selectmen, building commissioner, and part of it was actually that requests for information from Mr. Buscari was sent to the wrong address. All of this has been worked out. So basically at this point, just want to make sure that everything is in absolute order. The second part of this is approval of using the inn as temporary shelter. So we felt it was important that, again, that we have all the approvals in place so that there's no questions about whether occupancy is permitted.
Okay, so whenever there's a delay in somebody's paperwork or something is out of whack with the process, it's now going to come before us to approve with every permit? Or does Mark not have that authority anymore once something goes out of it?
I think at this point,
I guess I'm just asking process here.
yeah,
Why is this being singled out, I guess?
Attorney St. John, can you?
Well, I can clarify, I think, a little bit of what's going on. This is, Dr. Rhodes has mentioned, is a two-part process. There was, the first part of it dealt with, the issue involving the permit, which the Board of Selectmen has authority over in terms of renewing it. There was an issue about whether all the inspections were in order for the Board of Selectmen to allow the lodging permit to continue into year 2022. So I think what I'm hearing from Dr. Rhodes is he's asking for your approval as a board that you're satisfied, at least from your end as the Board of Health, that the Board of Health is okay with that for purposes of the renewal. There's a second component to this which he's raising, which deals with the request for temporary housing. That's a separate matter. I don't think you're voting on that right now. I think what you're voting on is just making sure you're satisfied as a board that basically all your ducks are in a row, that you've received the sign-offs from the Board of Building Inspectors, Building Inspector's Office, Code Enforcement, Chief Pansecchi's right here, from his department as well as anybody else that may be weighing in on this. Those are the three that I'm aware of.
Okay, thank you. So my understanding is that everybody signed off except for Jared. So,
And he has approved the building inspections. It's just that he did not put the clip box on our permit eyes for the health permit. So that's a formality. But just want to have that in the minutes that we understand that he will be doing that.
and then is Mark on yet?
I think it's on by telephone, it looks like.
Can we just get a confirmation from Mark, that everything's
Mark, can you hear us?
where it should be, I guess.
Yes, I can hear you.
Oh, where'd you sign in on? Are you on the phone?
I'm on M. Blaisdell.
Okay, all right, good.
So Mark, can you confirm that everything is in order with this permit?
Everything is in order with exception of the sign off from the building inspector.
Okay, is that because he doesn't approve or he didn't have the time to click that box?
His last entry was a disapproval on December 3rd.
Okay, so we
Yeah,
don't know.
The certificates of inspection were signed on December 6th.
I believe was this the door handles versus the door knobs? Was the hold-up issue?
Those have been taken care.
And they haven't taken care of, so that, it seemed,
The door handles and the access to the basement have already been taken care. I mean, he hasn't shown up to see, but both the door handles and the main door to the basement has already been done. A new door has been installed, and from our end, there's nothing which needs to be done.
as these are emergency exits, they need to have door handles versus door knobs. And so that's,
That door knobs were basically for the office building where they can enter it, but now they have both the handles changed. And then he had a concern that there should be a new door which should be installed in the south building where somebody needs to go to the basement. I mean, that door has been changed and the two new handles have already been installed. So if you guys want, I can even send the picture for that.
I think, no, I'm satisfied.
I guess I don't know, Chief, you've inspected, right? And everything's good on your side?
Oh, yeah, everything's squared away on mine.
Okay.
We did have an issue over the weekend. The alarm activated. None of the alarms appear to be activated, but there was one damaged. You can all set your ticker sweatshirt and did this, knock a piece off of it. My thought was that possible smoke in the rooms. From what I understand from Captain Geezer, that was addressed to that person. So hopefully we want to work out with that. And I did ask, so I had to post in the rooms that when the alarm goes off, you're supposed to exit the building. You call 911, that what's wrong with the detectives and everything requires them to leave the building.
Yeah, I've changed the fire alarm over that in that room, and for your convenience, I have placed the master key outside on both sides of the building that in future, if you guys need any entrance to any particular room or all the room, there is one key, which is the master key. You can just put it on the lock and you will have access to all the rooms by just using that key. So those two keys.
And that's for a lockbox to be put in that we have a special key to.
Yeah, special key. It's like a wrist key. And the moment you put that key to any of the locks, I mean, it's for the owners or for the managers, so they can have an access to each room. Those two keys are now one in the main office and one outside this big building in a locked box. Whenever you reach there, you can take that key out and you will have access to all the 16 rooms whenever you want.
I'll talk to you further on that because we have a special lockbox we use. That's what I give you the order information on. That we have a special key for.
Yeah, that's a special key for you guys.
You put the lockbox in?
Yeah.
All right, who put the key? You can't put the keys in without my key.
Yeah, that's the key which we use it for entry to these rooms. So that's the master key, which is outside that small box. So you have that key. Once you open that, you can have an access to all the rooms.
I'll give you a call tomorrow. We'll talk about what you put in because I'm not sure what you put in.
Yeah, I can do that. That's not a problem.
Pete?
I mean, it's a master key, I mean, for all the 16 rooms, so you don't have to use a separate key for each room. That's one key which will open all the 16 doors. That's the call like a master key which company provides us.
Yeah, I'll talk to you tomorrow where you put them in and how to get into your box. You put it in. We use a special Knox box that we have a key for. So. Otherwise, I'm happy with everything's going on down there right now as long as we have any problems. But some, we'll have to wait and see.
Thank you.
So I guess I'm hesitant because I'm not hearing, I guess what I heard from Mark is that Jerry hasn't signed off on this, so this is where I'm hesitant, so I don't know if I want to vote yes here because
We had a meeting last
Jerry,
night.
I guess.
We had a meeting last week. And Jerry sat there and he said that this was the last thing, the door latches versus, door handles versus door knobs. And as you hear, Barry said he has replaced them. And Jerry just has not gone back. He said he would go back sometime this week, which apparently is not yet. And confirm. So it's basically, as far as I can see, Mr. Perry is taking care of everything that the town has asked him to do. And it is a formality. Jerry signed the building inspections, but he did not click the click box on our permit. Why? I don't know.
Well, that's my understanding, and I believe that, but I guess I don't get that same feeling from Mark with his answer. Mark, can you clarify, I guess? Is Jerry on here?
No, he's not.
Okay.
And I thought he was going to come to the meeting because of these issues, but he is not here, so I know we don't like to talk about people when they're not here, but all I'm saying is that the last I heard from Jerry was at that meeting we had.
Yeah, and I don't want to hold that up. I mean, I trust that things are in place. I'm gonna abstain.
But I still need your second.
We second it.
Oh, yes, second.
I'm gonna abstain.
Okay, so then I need to call for a vote. So any further discussion?
Nope.
Okay. Pete,
Abstain.
Joyce?
Yes.
Dave, yes, so it passes 2-0 to 1. So, permit, we approved the, first occupancy, the Board of Health occupancy permit for Mount Royal Inn for the year 2022. The second issue, now that permit, now that occupancy will be granted, is the request of Lewison House to enter into an agreement for temporary shelter for individuals in need, transitional families and so forth. So the board has to approve this use of the Mount Royal Inn in order for the agreement to be in effect. I don't know if there's anything more that I need to say, but the Lewison House and Mount Royal Inn have entered into an agreement that passed legal muster to allow such an agreement and to allow such temporary housing, Mount Royal Inn to be used temporary housing. So I believe all we need, I think the motion would be to approve the use of Mount Royal Inn as temporary housing for the Wilson House.
I would entertain the motion.
No, well, just, it says, is this the,
It wouldn't be necessary. It's not a full hotel. It's only certain rooms. And it's built into their contract that they can't have hot plates, which would require 500 square feet. So it doesn't fit the criteria for housing.
It's not under our authority.
okay. Yeah, trying to use the term temporary shelter. Not housing. No, I understand. Yeah,
Just let them operate under their lodging rules.
Right.
Lodging permit.
yes.
That's my read on it. It's saying.
Well, originally, we were talking about a motion for temporary housing. And
Well,
this is
yeah,
not,
that's
that is what you're saying, because now the contract is not allowing hot plates. And they're simply occupying it as another occupant of the motel.
Yes.
Exactly.
And the second factor was the change of use, which would have triggered aspects of the house. So it's my understanding that it's not the entire motel. It's only a certain portion of it. And I have not had any further discussions with the building commissioner. Who would say that it is in fact cheap.
Okay, so if we change the word temporary shelter versus
Any,
what do you think? Okay, so this is, we don't even need a motion, we just, the agreement needs the occupancy permit, which we now have.
well, not
No, I mean, that's what we just voted on for the supported.
for the lodging.
Lodging permit.
So they're just gonna
Yeah.
operate on that. They have contingencies built in with the contract itself. If someone decides on their own accord to stay for that 30 days or more.
Right.
So they'll take care of that. And my interpretation of the changing use is not for, it would be for the entire complex and not for just say.
The portion, right, okay.
So,
So the second item here is moved at this point.
yes,
And so, okay, so good. I would like to move on because we are now 5 minutes past schedule. I just want to make sure we move along. And so, thank you. So, Kathy Keiser, you are good. Mr. Bucari, you are good. Thank you for coming and wish you the best in taking care of your business. Thank you again. So I'd like to move on.
Thank you.
The presentation by Jennifer Kimball of Berkshire Opioid Addiction Prevention Collaboration. And I knew you were retiring. I did not know that today is your last day. And so this may be your last act as director. So I feel particularly honored.
Of course. I'm happy to be here. Thanks for having us today.
And Stephen Murray from,
Stephen Murray is a harm reduction consultant with Never Use Alone and also a former lieutenant of the Northern Berkshire EMS and now currently an employee of Boston Medical Center. And I'm also joined by Sarah DeJesus from Berkshire Harm Reduction, which is a Berkshire Health Systems program, also known as the Syringe Access Program, or the supplier of comprehensive drug user health services. So they are both with me tonight. And I do have a PowerPoint presentation. Okay for me to share my screen?
it is just before you start, though, we do have in the room Fire Chief John Cessation. And I don't want to tell tales out of school, but I don't think the fire department carries
You
Narcan.
know, it's, I know.
Okay, so this is, I'm happy that he's here, so he will learn about the availability here.
Yep.
And the meeting is being recorded, so those other first responders who have not had a chance, I will make sure that they get a copy of your presentation. So,
Okay.
I believe you can just share screen, is that?
I cannot do the usual, let me see, it's letting me do it. Okay, great. I will go ahead and get this going. So my name is Jennifer Kimball. I'm a principal in public health at Berkshire Regional Planning Commission, where I've served for the last 10 years. I've been coordinating the Berkshire Overdose Addiction Prevention Collaborative for around 9 years. And I'm going to be giving you a presentation that was given to the Berkshire Public Health Alliance on September 9th, 2021. David asked me to come out and give it to the local Board of Health. So I'm glad to be here, and I'm glad to be here with my comrades who have helped me with these projects along the way over the years. So the Berkshire Overdose Addiction Prevention Collaborative does a lot of work around opioid use disorder, which was the original grant that established us, but around multiple substance use disorder issues, as well as diseases related to drug use, such as hepatitis C and HIV. And we do a lot of primary, secondary, and tertiary prevention measures. And we have several grants, but I'm here tonight to talk to you about 2 of them in specific, called the Overdosed Data to Action Grants, which are 2 grants that the Berkshire Regional Planning Commission was awarded from the CDC through the Bureau of Substance Addiction Services. And related, that's why I want to talk about them both. They both cover comprehensive harm reduction services, as well as access to Narcan, which I think will be also very important for your first responders in your town. So the first Overdose Data to Action grant that BOPC received was something to expand post-overdose engagement services throughout Berkshire County. That is a harm reduction EMS model that will follow up with a client post-overdose within 24 to 72 hours with phone call or a text, and try to establish a healthy working relationship with this person and encouraging them to care for themselves, meet them where they're at, see if they have any needs, from food to housing to health insurance to supplies, and just kind of work with them over time and establish a relationship with them. So this is a pilot program that's starting with Berkshire EMS and will be rolling out to the rest of the county. This also utilizes a HIPAA certified comprehensive case management system that will be utilized and will be connected to matrix systems and other systems that are often utilized for people doing this work. So that's the first Overdose Data to Action grant. The second Overdose Data to Action grant is around expanding harm reduction. And this relates to both the post-overdose engagement program, but also local boards of health, and that's why we're here. One of the things we wanted to be able to offer people when our EMS site, when they've reversed an overdose, along with, providing all the care to the person as well as the bystanders and family members and getting them connected with services, is to be able to leave Narcan behind on site, which is something that needs, some regulations to be covered, that Stephen will talk about around OEMS regulations around that. We wanted to be able to leave Narcan on site post-overdose because often they have discharged or utilized their Narcan, and they can be often at risk of an additional overdose 30 to 90 minutes afterwards, or they might go use right away and might not have time to refill that Narcan. So we wanted the EMS to be able to leave that Narcan on site. We also wanted to make sure that EMS could leave clean supplies on site for people who use drugs. And right now, because of the way regulations are written in Massachusetts, they can leave some, but not all of supplies. So I'll get to that later. So expanding, right now we have 3 comprehensive drug user services sites or syringe access programs in Berkshire County. There's one in North Adams, there's one in Pittsfield, and there's soon to be one after the first of the year in Great Barrington. But as we know, many of the people that we work with are transportation challenged, and there can be a lot of barriers to getting fixed site services. And why we're doing this harm reduction EMS model is because EMS is running 24/7. So the goal of the grant is to connect with the remaining 29 local boards of health in Berkshire County, as well as Rowan, Monroe, and Franklin County that are served by Northern Berkshire EMS, and who have not allowed for comprehensive drug user services, health services to operate within their town, to get them to sign a local control letter so that all the supplies can be left behind on site. And to work with other regional EMS and mobile health systems to try to get mobile comprehensive drug user health services going throughout the county, and really to health outcomes of people who use drugs, as well as their families, and reduce the amount of HIV, hepatitis, and hepatitis C in Berkshire County. Luckily, our HIV numbers in Berkshire County are remaining low, but because of the opioid use disorder crisis in our country, Berkshire County, actually the entire state of Massachusetts, is considered at risk of an HIV outbreak related to drug use. So this is kind of gets us a little more urgent around providing these services. And as you may already know, hepatitis C rates in Berkshire County remain as high as the rest of the state, and in some cases higher depending on the municipality. So I wanted to make sure that you had a chance to interact and hear from Sarah DeJesus from Berkshire Health Systems, Berkshire Harm Reductions Manager, to talk a little bit about the services they provide. So Sarah, whenever you're ready, you can go ahead and just let me know when you want me to advance the slides.
Sure, thank you. So I think the main point really about our program is really reducing negative consequences related to drug use, either the person who is using themselves or friends and family that are connected with that person. And there's 2 really important ways that we work towards reducing those harms. So providing new injection supplies for people, therefore reducing, like Jennifer said, infectious disease like HIV and hepatitis C. And also Narcan or naloxone distribution to reduce overdose deaths. So we distribute a lot of Narcan. We encourage anybody who utilizes our program to carry Narcan. And we collaborate with a lot of community agencies to kind of filter Narcan into the community where people are most likely to witness or respond to an overdose. We also provide testing for HIV, hepatitis C, syphilis, gonorrhea, and chlamydia, and treatment for any of those results that come back positive. So we have care coordinators and healthcare navigators that help kind of walk people through the healthcare system of treatment and medications and storing medications and making sure everyone stays on track with treatment for those positive results. Basic wound care we provide for people if someone has an abscess or an injection related infection that they're concerned about. And then we regularly connect people with additional resources in the community, be it housing supports or insurance, if someone doesn't have insurance or needs help with their insurance, food resources. We help people get to detox and secure a bed if they're looking for that avenue, helping with transportation. We kind of become a safety net really for whatever people need and connecting them to other resources. Go ahead, Jennifer. So I talked a little bit about collaborating with other organizations related to Narcan, but really a big part of what we do is education for infections, for Narcan, and just constantly reinforcing positive messaging to people who utilize our program and keeping them as safe as possible while they're in that stage of chaotic use. Go ahead, Jennifer. So we started a hepatitis C telehealth treatment program in June of last year. So prior to that, a lot of participants who utilized our program didn't have access to treatment for hepatitis C. There was a lot of barriers that were put into place. So there's just some statistics on here, and it's really, the numbers to me, from my perspective, are one engaged 80 people in some phase of the treatment process in about a year and a half. Prior to that, our program opened in 2017. And so consistently for 2017, 2018, and 2019, that number was 0 every year across the board. We've not been able to get anybody into hepatitis C treatment. So we started this telehealth treatment and really broke down a lot of barriers to get access to treatment for people. So, and those numbers honestly are a bit higher now. Those are a little outdated. We're probably closer to 100 people at this point. And there's constantly new people engaging in the program and getting treated. So I think overall in the long term, specifically our hepatitis C numbers are going to continue to decrease in Berkshire County because of this program. I think that's my last slide. It's not, just kidding. We also, as Jennifer talked about, expanding services. We have the brick and mortar sites in Pittsfield, North Adams, and Great Barrington, but we've also just acquired a mobile medical unit. It's a 24-foot RV that has the capacity to provide all of the services that we do in-house, but mobily. So the testing, the treatment, the syringe exchange, the telehealth, Narcan, all of our services we'll be able to do on the RV. And one of the other components of our program is just syringe disposal. So anybody can drop off syringes to us at any time. So for example, if someone is diabetic and has nowhere to dispose of syringes, we take those at no cost for people. There's no cost for any of our services that we provide. There's no fees associated with it. So it's all very accessible for people. We've expanded our Pittsfield hours specifically until 8 p.m., just trying to be more accessible for people. And then consistently just looking for additional locations where we can be of benefit and serve the community.
Thank you, Sarah. Good afternoon, everyone. My name is Stephen Murray. As Jen said, I'm recently retired from my 8-year career in EMS and fire, mostly retired. I just left Northern Berkshire EMS full-time. I was a lieutenant paramedic there, but I got my start in the fire department in Lenox and worked at Pittsfield for many years. I'm also an overdose survivor myself and a person in long-term recovery from opioid use disorder. And right now I'm working at Boston Medical Center in their addiction research department on these sort of programs. So it's nice to still be able to be here and be part of this work locally. So we have started leaving behind these kits after overdoses. So both Northern Berkshire EMS and Lee Fire have been doing these. I build these kits out. The Narcan is provided by Berkshire Harm Reduction, and it includes like a CPR mask and a bunch of other resources, and they come in these nice little pencil case packs. We've given out, I think, like 12 up in Northern Berkshire County. I'm not sure. Lee's given out a couple as well, and hoping that Mike Leeson wants to expand and have Adam start doing it as well. One of the things that I'm working on at the state level is to reduce the requirement to get medical control permission to do this program. So hopefully it'll be much easier for us to roll out. You can go to the next slide. We're also working on a small pilot program to start leaving syringes behind at the scene of overdoses. I think one of the things that Jen pointed out is that, most overdoses happen at kind of non-banker hours. So like in the evening, on the overnight, or over the weekend, and places like Berkshire Harm Reduction may not be open. So we're able to leave stuff behind for people in off hours, which is super beneficial, and is consistent with our goals as a community to spread or reduce the spread of HIV and hepatitis. And so I think this is an important program. And I guess since Chief Pansecki's here, hi. We are doing this program through BOPSI now. You may have seen it in the Berkshire Eagle. There's been a couple of different articles where we're working to expand Narcan access to all first responder agencies in the county. When we started the program, 45% of police departments and 55% of fire departments were carrying. I'm proud to report that we're now over 90% for both, including most of the departments here in Northern Berkshire County. My understanding is that Adams Police does carry Narcan. We're hoping that Adams Fire would be interested in as well. And basically what that looks like is that we provide the Narcan free of charge. I handle all of the paperwork and provide training and technical assistance, and it's all free. So at no cost to the department or to taxpayers. It's all covered under a grant. I'm still here in Berkshire County. And so I am still getting this program going. We've had department sign on as recently as like 2 days ago. And so this is a continuing project, and I'm happy to meet with you to discuss. So that's just my little spiel on that. So
If you're interested, give me a call, we'll talk and see what we can do.
Sounds good, I will.
Yes, and we just today delivered 96 Narcan kits to the Pittsfield Police Department, who are now carrying in that, and holsters for all of the Narcan for them. And this is something that we're for free to all first responders through a partnership with Northampton's Health Department and their DART team under what's called a COSEP grant. And so Stephen is available, for follow-up for all of this work as well. So we strongly encourage your first responders to follow up with Stephen. So getting back to being able to leave all these very important tools behind on site, the local board of health is key because of Massachusetts General Law, Chapter 111, Section 215, under needle exchange programs, where it says that the Department of Public Health may implement a needle exchange program for the exchange of needles in cities and towns. Prior to implementation, the approval must be obtained from the local board of health in the hosting city or town. So that means that right now, we have several municipalities who have voted in favor of syringe access within their towns as small as Peru and Egremont, but beyond the fixed sites that we know we have. And these are towns that are indicating that they really like their EMS and harm reduction providers to be able to provide these services in their town, as well as be able to have Sarah's mobile van, come through town in coordination with the town. But what needs to happen is the local board of health, i.e. the Adams Board of Health, will need to take a vote and show what's called local control. Each local board of health needs to do this in order for these services to get in their town. You need to put us on the agenda like you've done. You need to bring it to a vote using, and we will provide exact language as cited in what's called a local control letter. Make a motion to approve these harm reduction services for your town. Take a vote, and then with the letter, with the local control letter needs to be sent with a copy of the certified Board of Health minutes to the Bureau of Infectious Disease and Laboratory Sciences, and then wait for DPH acknowledgement and approval. And it's very quick. It's less than 90 days, but we like to keep the 90 days on there just because of COVID and just personnel stuff. Sometimes things take longer than it should. But And without the local Board of Health taking this vote, these services, anything having to do with syringe access or being able to leave behind these kits or having the mobile services come through your town it can't happen with a publicly funded syringe program. It should be noted that syringes are decriminalized in the state of Massachusetts, and that any privately funded organization can do these services at any time without local Board of Health approval, although it would be a very nice thing for them to do. So what the motion needs to say from the Board of Health is that that you move to allow a qualified and appropriate organization to operate a mobile syringe services program in the town of Adams. And that is a sample local control letter there you see on the screen. You take a vote and with the minutes to the Bureau of Infectious Disease, and this is an old training, that is kind of that. So I was going to stop sharing now, and I wanted to open the floor for any questions you may have for any of the three of us.
Well, number one, thank you. This is extraordinarily informative and just very impressed with all you've been able to accomplish and all you're doing. I think we need to put the letter or our vote on our agenda for next meeting, which I am anticipating will be the beginning of January. And so we'll look forward to the letter and the actual wording of the motion so we can discuss that. I do have one question, but I'll wait and see if our other board members or Officer Blaisdell or Chief Pensecki have any further questions. Yeah.
Are there any resources available for local boards of health to be provided with safe means of needle confiscation? You know, when someone turns them in, we don't have anything here in town hall at my office. When someone finds needles, used needles.
Different municipalities do it differently. We do sharps containers that we provide for free to people. Some Board of Health offices will go and pick up a syringe or say that a person can bring the syringe or, into the office. Some towns have sharps disposals at a transfer station, and then other towns have a whole sharps disposal box placed. I think that would be a discussion for you to decide where maybe how you wanted to do it. But one of the benefits of Sarah's mobile services would be that one of the things they can do, is pick up sharps if someone's dropped them off at your office when the mobile van is coming through. But you do want to have a safe sharps disposal container at wherever you decide that to be. Or, sometimes I don't know how many I have left, but things you can keep sharps. They're very inexpensive, smaller sharps container at your Board of Health office, at your town office, and people can pick them up. So they have them at their house and that they can, swing by when Sarah's van comes through town. Things like that. It's kind of, there's a variety of ways to do things depending on the municipality. If sharps containers are something that you'd like to have at your town office, you can just let me know.
One other thing that exists as well, in Pittsfield, I believe they've contracted with one of the ambulance services where if one is found in the community and they call the dispatch center to say, hey, we found a bunch of syringes in XYZ Park, the ambulance usually will come out and grab them and throw them, because we have sharps containers on all of our trucks. So we're comfortable with and used to handling them. So that's another option that you'd have to work out with Mike.
Okay, thank you. In Pittsfield, I worked in Pittsfield. We did have the sharps containers. Every inspector had one in his car. And we discouraged people from actually bringing them to us. We would go out and get them. That's the safer thing. And then obviously within our health department, we had the larger containers too. And we had a means for disposal of full sharps containers. So yes, if you do have some that you could give to us so we can keep them here in town hall. In the event, I've been here 2 years and no one has brought any in, nor has anybody made any complaints about finding them in the community. That's possible. And then also, when I was in Pittsfield, there were a lot of responses to areas of the community where expended kits were found. So we would retrieve those in the same manner as we did with expended needles. So we would need a larger container if you're going to give one to us. That's what I'm saying.
What kind of, can you explain what the kits?
They have the cookers,
Okay,
everything that's in a kit that was used.
okay. I just wanted to clarify. That's what came to mind for me, but I wanted to make sure.
Yeah.
Yeah.
So the challenge question, and, and that is leaving Narcan kits behind in the home of a user. Does that open the possibility that the user would take more risks? And I suspect that you have an answer for this. And it's probably not the first time it's been asked for a program like this. I totally support, but I just kind of want to have the full perspective.
Stephen, you have a really great answer for that, but I just want to clarify. So you're wondering if Narcan would increase the possibility of the person using again, or?
Taking, knowing that it's there at the table, you can take more risks in getting high because the Narcan is there. Versus having to call 911. So, what do you say if a critic would bring this up for a program like this?
So currently speaking, the American drug supply is in such bad shape in terms of like fentanyl contamination that every time somebody uses, they're taking a pretty high risk that they're going to overdose. When we think back to 5 to 10 years ago, the overdoses per person per year were much lower than they are today. The problem with synthetic fentanyl is that it doesn't take much for basically one dose to be much stronger than the one before that, and so when they're measuring it out, it's quite inaccurate, I guess would be the best way of putting it. So the people in our community who are using drugs are already at such unbelievable risk every time they use, and I think that that's a well-known fact among the drug using community. Unfortunately, efforts to decrease the demand side or the supply side when it comes to drugs have failed quite miserably. When we look at the American drug war over the last 30 years. And so people like Jennifer and Sarah and myself are about taking a safety first approach, which is where we acknowledge that people are going to be using drugs and they're doing it for their own reasons. And our goal is to increase safety and increase options for safety. Having Narcan in your house, it's no different than you having a fire extinguisher. Like if you have a fire extinguisher in your house, are you less likely to like start a grease fire or need the fire department. Like, I think things are tools. You know, we need tools at our disposal to be prepared for safety risks.
Well, the other half of that is the, you know, the post-overdose engagement program is, to me, is a way of basically moving the user to a less risky lifestyle or whatever. I appreciate that effort, and I know how much harder it is to do that, but to me, that's really such an important component of, you know, it's not just leaving some stuff behind, but actually the human relationships.
And I think it has been shown, and Stephen, you can back me up on that, that Narcan does not increase riskier use, does not increase use, and that the concept of things like Narcan parties or people just being careless because they know Narcan around, I think a lot of that has been debunked by science. And so people used drugs and they can't take care of themselves if they're dead. So like Stephen said, you know, these are tools, but, you know, some of the biggest tools we have are relationship building within our community and our community members. And having somebody involved with Berkshire harm reduction and building relationships with the purveyors of services from them is a great way for someone to start taking care of themselves and reducing the risks. And so that's why we're here. And that's what we hope to continue throughout Berkshire County. And so we'd love for you to put us on the agenda for your next meeting. If you wanted to be clearer on the agenda that this is what we're going to vote on, if you think that would be better than taking a vote tonight, we completely understand that. But I'd love for you to take a vote tonight if you could, but I understand. I won't be here, but I know Stephen and Sarah will be able to be there to answer any additional questions if I'm not.
I think our town attorney, our town council will say, hey, next meeting, is that right?
That's right.
So.
One other thing I would just throw out there as well is that it's really terrible to be Narcan. It throws you into precipitated withdrawal, and it is extremely painful and uncomfortable. So there's no fun in that. It would be like the equivalent of injecting yourself with the flu at the height of the flu instantly. That's how I could equate it. And so I don't think anybody wants to be Narcan. It's not something that's fun.
Yeah, I did not. Now I do remember that from the training.
It's not fun at all. Trust
Right.
me.
Okay. Well, with that, anybody else has Stephen and John are going to be in touch with each other, and we will give Jennifer congratulations for all she's done and best wishes on her next steps. And we will be in touch with Sarah and Stephen going forward. And thank you all.
Yep. And you can let Laura Kitros know, Dave, too, and just keep her in the loop too. But thank you so much, everybody. It was great to see you.
Okay, thank you.
Thank you.
Thank you.
Okay, well, what's next? I think I have the COVID report here. I will try to. I think I have to go through it in too much detail, but there were just a few things I wanted to mention, and Marty or Joyce Pete to bring in and Brian, this is on our website. You don't have to take pictures.
I just like to take pictures anyway.
Yeah, it reminds you. So, so this is the one that I did on Monday. And, so, like to have a weekly message, and I do consider that we are at extreme alert because, and you'll see a bit later, you know, the numbers in town each week that Nancy Slattery gets are daunting. But now vaccines are available for almost everyone these days, down to age 5. I just learned today that the Health Alliance and Health Association have vaccinated 2,000 of the 7,400 children in Berkshire County who are eligible to the 5 to 12, 5 to 11 age group. And then Berkshire, Northern Berkshire Pediatrics has immunized. And so we're basically through that and continue to vaccinate. Boosters are available. The workplace safety standards, this reporting that we passed last meeting. It's I wanted to pause here with the cessation of contact tracing. Yesterday, at the Department of Public Health webinar, our state epidemiologist, Catherine Brown, pointed out that COVID now is so prevalent that contact tracing actually doesn't make sense because you can catch COVID anywhere. So just who were your close contacts? Well, you can catch it basically just going about your business. So it's difficult to find an index case and then say, who did you follow up and then quarantine those exposures? But on the other hand, there are sites and workplaces. One of them, the schools take care of their business as soon as it gets turned positive. They do the isolation quarantine, and with Mark's help, workplaces the same. And for workplaces, it's actually even more important than schools because the school population tends to be localized, although we have our and but for the workplaces, it's countywide. People travel North County, South County, and so being able to identify and the local, at least individual thing is very important. Yeah, these are just the numbers. The orange, there are 58 for the week ending December 9th. Nancy will give me new numbers tomorrow. See, we've gone from a high last week of 63, 58 isn't that much further down. And so I am, given the state numbers and the county numbers, I doubt we're going to be any lower. Do this crazy calculation here. The number of deaths in Berkshire County, 335, and that's 1 in 373 persons in the county. So it's kind of daunting. It's actually, we're a little bit worse than the state, but not by much. And then again, these are 14-day case counts, but they ended December 4th because the delay in the state. And again, Adam's sitting there at 129, which is way too many cases. It's a combination of the rates and the right chance that that picture there. But this was the one that I found this a couple weeks ago, and there was a little article that was basically saying what's the same, what's the difference, and you can see December last year, December this year, we have the rise going on, and what happened after the rise, we had a couple, another peak in January last year, and the question is, are we going to see a similar thing this year? We don't know. We can't see the future, but we can see the past. The difference is the cases now are indeed milder because they're more vaccinated people. But we are still seeing an alarming number of cases, and people are dying. What was it yesterday? Was it 61? 61 deaths yesterday? Or the day before? It was a huge number. It goes up and down, but it's so. And I will stop this because now that kids are eligible for vaccinations, it's kind of crazy to break it out, but it's both vaccinated and unvaccinated people are getting COVID. So I will stop this share at this point and so got me to thinking about, because of our workplace emergency order, actually thinking about an indoor mask mandate. Several communities in Massachusetts have done so. State government is very reluctant to issue an indoor. Some towns have made it a mandate unless an enterprise is fully vaccinated. There are different nuances here and there. But I would like to hold a public hearing at our next meeting to consider whether to issue an indoor mask mandate versus a strong recommendation. There are pros and cons for this, but I think it would be important that we invite the public and ensure that I know there are a lot of individuals out there who would be in favor, and I would like to hear from both sides in a, I might say, a civilized and rational manner. Thoughts, Joyce, Mark?
Start on that side.
I have no thoughts at this time.
I think that given the fact that our January meeting will be after the holidays, it'll be interesting to see what our numbers do. Because by the time the next meeting is held, we're looking at over 10 days out from holiday.
Yes.
So it'd be interesting to see what happens with that. I mean, I've been doing a lot of reading. I think people are all over the place with mask mandates, and so I'd like to see what happens.
I think it's very least, bringing it out as an open discussion. It brings out, I mean, because Mark's not gonna go into every place and be checking, you know, he can only do so much.
You don't know Mark, do you?
It would be responsive, just like it was during the state of emergency.
Mhm.
Obviously, if I was in that establishment, saw something, I would have it corrected. But again, people from other communities travel to this community, travel through, stop, do some shopping or whatever. And likewise, our residents go elsewhere. So again, I say that the numbers that are shown on our website and Dr. Rhodes' report are not exactly factual or accurate to this community. It doesn't take into consideration those other variables. I will also say that there are a lot of at-risk businesses that do need masks for their employees and customers. I just had one last week, added to that list. They wanted big time. So we have signage available if any business wants that type of signage or the encouragement signage that can happen. We need to do all that we can do to help reduce those numbers. I'm not so sure that a mask mandate will do that, because you experience, whereas the people who oppose are more vocal than the people who support. Okay, so just take that into consideration at the next.
Yeah, I would definitely reach out to a number of community organizations that I would feel, I think my council on aging might be, for instance, in favor of mask mandate because of the need to protect. But so, and again, my goal, I think, would be mostly to have a public hearing on what do people think, what do they want, so we can follow the people of Adams versus telling them what to do. That makes sense.
Just keep in consideration too that the elderly or the aged population was at one point the vulnerable population along with people with comorbidities, but now you also have that segment of population that is not entitled to it, or they don't have availability for vaccination. That's the 0 to 5 age too. So I would next meeting encourage you to give that consideration, and we should probably find out from Dr. Doyle how many of those cases, because when they do the ages,
Yes.
That 0 to 5 is inclusive of the older age.
Right.
So that doesn't exactly help the true story of vulnerable.
Right.
Also important to make sure that we have some data.
Right.
For Massachusetts, Berkshire County, and Adams, because I think that was a sticking point for a lot of people last time. So we need to have all our ducks in a row, make sure that we have a good solid presentation to people. See both sides.
And Frankie Paris did an analysis of the risks of vaccination versus the risks of COVID a couple weeks ago in the Eagle, and one of the pieces of data that she cited was that children do get sick with COVID and children do die. She said that COVID is now among the 10 leading causes of death in children. So it's not like way down there, it's up there.
Right.
So you're right, I mean, that kind of information is.
And then so children, that group of children. So we need to identify narrow 0 to 5. We have to see.
So I don't know if we need to vote on this. Just to have a public hearing, I would, my plan would be to publish it in the, by Berkshire's. Because once I submit the legal notice, it will run every day until our meeting. It would give it.
Just remember, that's like a $300.
It is, the price is higher, but it's there and it's also, it's a free newspaper, so anybody can read it. And I think Brian will probably say something in this article, please, to highlight our calling for a hearing in order to figure out how to go forward. I would just add that metrics would be important, as Joyce said, numbers, who knows what they're going to be like in half a month, a month. And so it is important, but obviously the numbers are not changing now. So, okay. That sounds good. And then thank you. And thank you, John.
Thanks, Chief.
The last thing there was the 3 testing kits. I think Mark can probably say more about that now. I got a call that last night because of the late email from Laura Kidross, but you got more information and kits are going to be delivered to COK in the next few days.
Yes. It could be as early as Friday. I spoke with the director and the interim director at COA. And once they have them on premises, they will send out notifications to their networks, which will include Berkshire, Berkshire. And there some of the housing communities, especially Adams Housing Authority, they're going to take 84 kits, and so they're going to be distributed to those communities. And you'll have people going to get the kits. There are going to be 1,800. And Council of Aging will hold some there. We'll hold some here for walk-ins. And then Town Administrator Green tomorrow has an appointment with the Regional Emergency Planning. So we'll bring back some more information for dialogue tomorrow, Friday. And then we have a Berkshire County Boards of Health Association webinar, webinar tomorrow. Then we see what done there.
We you be able to okay, good. I have a conflict because and sorry to interrupt, but that there were a number of our colleagues who said their town was going to do this, that, and food pantry
Distribution.
Yeah.
Right. So I mean, our food Council of Aging is already happening. It's not going to happen again until January. So we want to get this out for Christmas. So this morning was a conversation, just dialogue, and so that's what we came up with. Because by 11 o'clock today, the state needed a decision whether we were going to take those, why not. And my expectation is that the conversation tomorrow with Public Health Alliance is going to be their invitation to talk to us more. That's usually what happens. So, fingers crossed.
So, I think the most important thing that I haven't heard is when do you use it? You get a free kit, you use it right away, or is there a good time for you to use it before doing this or after doing that?
It's always the case. If you get sniffles, just use it. If you think you've been in contact with somebody, yes, definitely. If you have symptoms progressing, definitely the fever aspect of it, and yeah, you use it. There's instructions in the kit, and you can also,
Like, yeah, that's the yeah. I mean, what
what they provide to you is very small. Small print. So flyer.
bigger, yeah.
Yeah, I think it'd be really important to hand out information so people just aren't using that when they really don't.
Yeah. I mean, I've had one out our no contact thermometer twice for only 2 days. And the print is so small, so I have bigger print. Just basic instructions.
Right.
So, yeah, and I get it in, I see it.
Good. Okay, well, thanks for what you've done and for, that's great. Okay, moving on to public comment. I don't have anything here, hearing none. Minutes of November 17th. I think I had one. It was smiling in the mask.
I'm sorry.
No,
Don't apologize. It's
I just have
fine.
some clarifications. On page 2, under emergency order, the sentence that starts, Attorney St. John stated that the words strongly encouraged is not considered.
I'll get rid of the end, yeah.
And therefore non-enforceable. And then the next sentence, the penalty section of the should of the emergency order, is that what that sentence is referring to?
Say that again?
The penalty section of the, and then it says should. So is it the penalty section of the emergency order should not be noted? Or I had a question on that sentence.
Maybe just get rid of the, or
The
add
penalty
the
sections should not be noted by that kind of language, or I was stuck in that sentence, but I know that it didn't. It seemed like there should have been something between the and should. So I just assumed maybe emergency order.
Yes.
I agree.
Okay, all right, then, the next paragraph, okay, the paragraph after that, the second sentence. Should it be how is this order helping with that situation rather than what is this order helping? So it should be how is this order helping with the situation? Rather than what? And then the next page, I promise, I think this is the last. under public comment, it just may be a matter of the way I would word something versus someone else, but Dr. Rhodes asked for public comment and asked that comments be limited to 5 minutes.
Yes, I agree.
And then the last one, I think I'm getting off. The last one is,
What page are you on now?
I'm still on the same page,
Okay,
and it's the second, under public comment, the second paragraph. Probably maybe 3-4 sentences down, it says also there are home tests being done which are not reported by anyone. Remove the word "to." Oh, no. And that's, I think, all of it.
Yeah. Yeah.
Yeah. That's it.
Pete?
I have nothing else.
Yeah, just under local and county updates on the last page. Yeah, where the roads are about 600 children were. This is the North County children were vaccinated by Northern Berkshire pediatrics.
repeat that again for me. What am I
So,
saying? Dr. Rose
heard
heard.
that heard that about 600 North County children were vaccinated by Northern Berkshire pediatrics. Give them credit for pitching in on
Dr. Rose heard that about 600 children, North County children were vaccinated by Northern Berkshire Pediatrics.
Yeah.
Okay.
I have a
Motion to approve November 17th, 2021 Board of Health 2 minutes as amended.
discussion. Pete?
Yes.
Joyce?
Yes.
Dave, yes, it passed unanimously. Okay. Moving on to old business. Officer Blaisdell asked me to put 760 Howland Avenue back. The condemnation.
So I accompanied the occupants to housing court last Wednesday. And the court ordered the landlord to put the occupants up in the hotel, at least until December 22nd, which is the next court appearance. The court ordered the landlord and the owners to abide by the correction order that was issued, condemnation order, as well as the board's upholding of that order. So the landlord has to do air quality and mold testing and lead paint testing. New development there was the lack of heat, and so the court also ordered the landlord and the owners to make repairs to heating units that are in that apartment. So that's where it stands presently. The occupants are no longer residing there in a condemned unit. They are temporarily in a hotel, and we're all expected to be going to the housing court on December 22nd for a status update in anticipation of the landlord and the owners not being compliant. I'm looking for a receiver. If I find a receiver, I will accompany the tenant in their rear care of that court petition the court for receivership of this property.
So give us an update on this in our next meeting, and so I should leave it on the agenda because it's pending. Yeah.
Yes.
Well, thank you. Discover Books, donation's been update. All that I have to say is that it's the ball, apparently it's in my court to negotiate with Tim Coda. I've been in communication with the concern. The issue is the location. We thought would be best beside the textile bin. Might not be the best place because they get another compactor. That's space might be needed for the compactor. So we may have to move the box. The good news is that I got a call from Gary Cremento today. Long chat, very nice, but have mentioned this issue that where we were thinking of citing it might not be the permanent place. Gary immediately said, not a problem. If we need to move it, we'll come out and move it. We have trucks in the area all the time. They're setting up bins at Waynesboro and Windsor. So, and will not be first, but he's very eager to place a box in our transfer station. So I will pursue that with Tim and see what we can do. Cannabis, given everything else that was going on, I did not get any base on cannabis webpage, so I will try to worry about that after the holidays. Budget consideration. The budget runs from the last 3 years. Organize that down. I don't know what to do today. I mean, kind of struggling with what is being spent and what the allocations are, the two big areas at the top, the code enforcement and legal professional services. We have seem to be no expenditures from them, but I would, yes, go ahead.
So you see there's a very large figure compared to the others, and that's an encumbrance from 2019, where my predecessor was going to go clean lien on a particular property. We weren't quite sure what that property was, but going through the minutes, it was for 8 Valley Street, which we're going to need that money if we have to do further code enforcement there. If the owner is going to be non-compliant or demolishing the building. In any event, there are some other properties that could use a clean lien. So that money is going to carry over its use. And when we identified that there's more code enforcement budget than the money allotted for postage. I spoke with TA Green and we had discussions about receiverships and what it actually costs the town. And the necessity for doing code enforcement from the onset based by my assessment of the situation, rather than going through months of code enforcement and and not doing everything according to statute, not serving the orders of the statute, which would hinder holders. So if we're not doing it correctly from the onset. 3 months down the road, you have to start again from square one. So what I did with this 78 or 76 Highland Avenue is I kept encouraging the occupants. Our budget was frozen. Kept encouraging the occupant. I got some other agencies to try to encourage her. Finally, she says, "Yeah, we're sick of living in this unheated, condemned apartment." And used her complaint, was heard by the court. The outcome was the same. If I had done it, well, I had done it, and then my budget was. So they wouldn't have been living in that condemned apartment. And thankfully, nobody was hurt. She suspected the kids were impacted by living in that apartment these several months. But it was shortened. It was shortened the duration of time. So we do have other monies available. It's not what was represented to us, to me, factually from the onset. DA Green was not aware of these other line items until I brought it to his attention. So, you know, I'm not given the complete picture. Questions are that I'm asking are answered, and you're not full information. So now you have full information. There's more monies available or which we have to post an order or publish an order in the paper. If the owners are outside the state and they can't relocate, now we're going to use this money frivolously. It's and the way I was doing code enforcement before was by dialogue, try to get corrections, and it goes over and then put to a statutory order. Or I would send it via email or regular mail, and that he was certified mail, still getting compliance. And after that first non-compliance, if it wasn't being done, I would then send it by certified mail. So again, that duration of time was short, but you know, given the order or given the instructions, you know, this is what you have. You said 500, and it wasn't 500, it turned out to be 550, and now it turns out to be less than that. So, but in any event, the money's available. It was never TA Green's intention to affect public health and safety in the community which it has. So, in this Island Avenue is a private vehicle. So, you know, he's loosening the reins, and, you know, not going to be spending money frivolously. He's still staying within those parameters, trying to get compliance by conversation, and with only using those monies with proof. So I remember talking about potential receivership for this Howard.
So I, Jay's been very busy, but I'm asking for a sit-down meeting, because I mean, if I look through this, I mean, to the first two line items there, the code enforcement and legal and professional services, I mean, fiscal year 2021, the quote 3,000 was budgeted, but only $30 was expended. And in 2022, in 2020, same allocated, but only 600 was expended. And so I'm not really sure.
Yeah. So if you recall, when all this started, you know, I was surprised. Okay, we used that $500 figure, and I'm like, what the heck? I had to ask for 4,000, and So if you look at the tally between those line items, that's pretty much what I was asking. Right. It's not just regular mail, it's not just regular certified mail, it's also publishing, and it's also a shared service. So when I gave him that $4,000 figure, that was for those types of service. Because without good service, you can't advance it or get kicked out of court. So you have to do it in Pittsfield. But for other communities, and when I came here, I was told many horror stories. And I said, no, that's not the way we're going to do it here. We're going to do things, according to the statute, so get these things and get them resolved, turned over a whole lot quicker than leaving them on the books for many years. That ain't Valley Street. That was like 10 years old, and so. So now we've got the accurate figures.
So let me be, I will answer Jay for a sit down before our next meeting. Because this is what we were told, that if we want any more information, we need to talk to Jay. And so I will try to arrange that before our next meeting. Yeah, because I frustrated. I don't like not knowing what's going on. So anyhow, that is that one. Okay, new business. Did you receive a? I didn't go look at this. Is there actually a document on recycling mandates? Yeah, I mean, I know you gave me a printout.
Yes.
So
that's the most recent. So there's going to be 2 changes that are going to come about in DEP's regulation for recycling. And
well, the textiles will be mandated. And what was the other?
food waste.
Oh, right, yeah. So
Which one?
So I think they are, I think they're downsizing. It used to be, there was a tonnage, and I think they're cutting the tonnage in half that would cause commercial enterprises to compost for their food, the organic waste that you could not throw that on. So that's actually a good thing. And there are actually compost farms around that will take anything. And so this is becoming somewhat of a new way of dealing with the food waste. So you have that as an electronic document. Yeah, if you could just send that to all of us, then we can look at it. And the other thing that I circulated, it's a bit lower. They ran Board of Health training wish list. Sandra Martin that loaded that out and I circulated it. The thing I found missing was cannabis, and she liked that idea, so she added that to what towns should know about having cannabis enterprises. We have the one upcoming and going in. Haven't opened yet, but so that was it on the safe grant. Local and county updates. I duplicated that line, but I did the day after our last meeting. I attended in person the Health Alliance Governing Board. We had met Andy Canby there prior to his naming health director of Pittsfield, a number of others of us, and we had an anniversary cake, which was really nice, and there were a number of individuals who joined us online. They have plenty of money, and I think I said they're hiring inspectors to service the smaller towns that don't have the wherewithal to hire a full-time inspector. Or replace them. And also attended the Conservation Commission meeting December 6th, where BHD presented their plans for the outdoor center of the plan. There, I think you wrote an article on it, and it looks like great. And one thing that surprised me is that they're going to connect the town sewer. I know a lot of the houses on the ridge are septic, if I'm not mistaken. Is that?
Yes,
Yeah,
but there's a dedicated.
but there's a dedicated, right? Dedicated, yeah. And so it just looked really looking forward to this center. It'll be a boom to if they into the outdoor stuff. So this will be great and attract people. Events, think of anything, holidays, email, Ernest has been very active in sending me stuff, transfer stations inspected and passed, all our transfer stations in the district did. So she feels quite rightfully proud of herself. We got recycling dividend program board of $49 for our recycling efforts. I think we that's usually with the administration for signature. There was a request to list textile recovery boxes publicly accessible on the DEP website. It should be because it's a mandate that is, you should not need a transfer station permit in order to enter and use these textile recycling boxes. Same is true for scrap metal, is that anyone can put in scrap metal because the town actually gets paid $55 a ton for that. And so it actually gives us recycling dividend program points if we have our transfer station listed. Because if you go to DEP and say, where do I throw this away? It will give you sites and where you can throw away. We're not throw away my washing machine because doesn't work anymore. Anybody can bring it and put it from any county. So that's an important kind of information.
They would still have to pay, no, for the bulky waste?
Well, that'd be something like mattresses or what?
So what you're talking about is not the textile box? So you're talking about like mattresses?
Well, you just mentioned about the washing machine. I would consider that like a bulky type thing.
Definitions for everything. So like bulky waste, that's a mattress or furniture. He's talking about metal,
Mhm.
so that's metal.
Yeah, that's
Um,
actually white goods. That's white goods is the official name.
Like your
Refrigerators,
appliances
yeah,
and such.
right, air conditioner,
And electronics is separate too?
that's,
But that's, it seemed like that was listed as a cost.
yes, so
Unlike
they're,
loan rates,
they're,
right?
the district actually runs collection. You know, sometimes the electronics with hazardous waste. Um, So, and the next one is hazardous waste is in April, so we'll get notification. Well, that is some. So, anything else? Okay, and the BOSI newsletter, which Jennifer, from some there, which Jennifer announced her retirement. Any other mail that is. Oh, yeah. It's gonna be.
Merry Christmas. Happy holidays.
Yeah.
Happy Hanukkah. All of the above.
Right. So when I, had a long talk with Howard Rosenberg this morning, sorry, he's not here, but, he was here for the, earlier part of the meeting. He's interested in, health and wellness programs. And of course, COVID's kind of showed a lot of efforts, but, we're talking, I realized that we've got a healthcare in town. I think, forget when the last one was. So we talked about that broadly. We're thinking that that would be a great opportunity. So I think it's usually in the spring or summer. I will have to look into that, but as we go forward, because being in organizing that, we get a lot of groups together that are interested in health. And I would like for us, and I hope both of you are on the same page here, to be a bit more proactive in promoting community health and wellness, and having a more organized group. And now we have a selectman who's dedicated its current life to health and wellness. That feel we have some critical mass here to move forward in positive ways, and also raise the possibility that we may have community impact fee monies available from the marijuana. Community health and wellness would be a good starting for that.
So you did a quasi, you did a booth, for the Thunder Fest. That was the one.
Yes.
You did that. That was the last one.
Yeah.
That is more, sanctioned. Town hall employees, we have Berkshire Health Group.
PhD,
Yeah.
right.
We have VHS, CHP mobile units that come on. Council of Aging, their thing. So I understand that you want something sponsored for that this board. This would be an advertising, and when you decide that, you need a candy. Candy
Uh-oh.
we had just frame and canopies missing. So if you intend to have anything out the door, I would suggest spend some of that money
Yes.
for quality that is access to it is controlled. Not available to whomever in town hall, which was the case.
Yeah, there were two bags. There was the canopy and the frame. And then when Mark got it for you, the frame also was there.
And,
But in any case, this is kind of the vision that I have as we grow out of COVID, that we can become a bit more intentional about promoting and events and promote. That next meeting, we want to be first Mondays, or first Wednesdays again. And try to keep up.
first one, that's what's advertised.
Yeah,
So,
yeah. And it is 3 weeks and then holidays.
Are we still gonna have an option for remote? We might have to remote in. If we do this then.
We are good for
I think we had been, I know,
until April Fool's Day.
oh, yeah.
April Fool's Day is when the current waiver expires.
yeah, we should find out about maybe putting a, there's capability speaker
Oh,
or microphone here.
yeah.
The quality is very important. We don't hear.
It is more.
Oh, you've done, yeah. So aside from that challenge that I experienced, and I'm like,
But yeah, the 5th will be fine. I don't know for sure if I'd be able to be here,
Right.
but I can make the meeting.
Okay. Motion to adjourn.
Motion to adjourn.
Favor Pete,
Yes.
Joyce,
Yes.
Dave, yes, unanimous. At 5:59, we meet to 6 o'clock.
I gotta find something to do for an hour. Something that's meeting.
Oh, right.